March is Kidney Health Month, and we begin our show today with a deeper look into kidney health services at Niagara Health. Felicia Bankole joins us. Felicia, how prevalent, first of all, is kidney disease in the Niagara region?
It is quite prevalent, actually. One thing we do not know about kidney disease is that you often don't get symptoms until kidney disease is actually quite advanced. Regular checkups with your physicians actually very well promoted, even here in the kidney health program at Niagara Health, just so that we can catch anything brewing in a person's kidneys early on, so that we can intervene early on before the kidneys actually fail.
What are some of the symptoms that people should look for?
So because the kidneys do a few things in our body, helps regulate water content in the body. And so one of the things to actually look for would be water accumulating within the body. So, swollen legs, swollen ankles, sometimes shortness of breath, and just, areas of fluid accumulation within the body that a person can see. Weakness, some general signs like weakness, nausea, vomiting, even regular, I wouldn't say regular, but itching, unexplained itchiness is something to bring, forward to your general practitioner so that they can do a deeper dive, to see what might be, the cause of that.
From the website, I tried to do some of the math. I think I counted 72 stations across the region.
No, quite more than that, actually. But what we have open is actually tailored to the number of patients that we do have. So yes, around that is what's operational currently.
Felicia, I understand that when people are traveling to the Niagara region, they can actually get their dialysis done here while they're visiting by pre-booking through Niagara Health.
That is correct, because a person with kidney disease is not limited in their ability to still enjoy life. So we have people vacationing or people even moving to the region, and we do, even as a province, want to make sure that they continue to get the services that they need, regardless of their location. So when someone is, say, coming to visit Niagara Falls, for example, they are able to connect with us ahead of time, let us know what their dialysis requirements would be, and we are able to accommodate them within our program here.
You also run a renal clinic in St. Catharines. Can you tell us a little bit more about what that's all about?
Certainly. So at Niagara Health in the kidney care program, we do look after folks with kidney disease across the entire continuum. So not just those that have dialysis or those that are currently on dialysis. So the renal clinic actually looks after people who have been identified as having some form of kidney disease. It could be at the very early stages. And these are folks that their family physician have, assessed them, and they've been determined either by blood work or by other tests to have some form of kidney disease, some level of kidney disease. And so we do start to follow those individuals in our renal clinic. The renal clinic is actually split into two. We have a general nephrology clinic where, those with mild kidney disease are seen, and this is where they're followed up with their physician, their nephrologist or kidney doctor here. And then we have our multidisciplinary care kidney clinic, also situated within the renal clinic. And this is where we bring in the entire team. We have a team of, renal pharmacists, social workers, nurses, dietitian that all work together to ensure that we're optimizing kidney health for our population.
You also help out with transplant referrals.
Correct. Our transplant referral pre-transplant clinic also operates out of the renal clinic here. And with somebody with kidney disease, advanced kidney disease or kidney failure, the best treatment that we can offer that person is transplant where it is applicable. And so we at Niagara Health are not a transplant center, but we do work very closely with our sister hospitals in Hamilton, in London, in Toronto, to get a patient, worked up for transplant and referred once that workup is complete.
Also offering, I would imagine, some post-transplant therapies, maybe?
No, the patient doesn't require much unless they're having, trouble with their transplants, post-transplants. Once they do undergo transplant and the transplant, I say, takes, it really is very smooth sailing for that patient. So every once in a while, they will be followed up on still at the transplant center where they're at but we do have local specialists here as well that, would offer post-transplant cardiac care if needed, or post-transplant, pulmonary care or lung care if needed. But those things are, on just on a as needed basis. Because like I said, once a person receives the transplant and is quite successful, they're able to lead quite, a normal life.
How long does a typical dialysis treatment take?
We have two main forms of dialysis. We have what's called the hemodialysis, which is, a blood taken from a patient's, circulated on a dialysis machine and returned to the patient clean. And there's also peritoneal dialysis, where, we instill some fluid into a patient's belly. That fluid collects the waste from the patient's body, and that fluid is then drained. What we offer in center at our dialysis units is the hemodialysis. And a regular dialysis treatment would go anywhere from 3 to 4 hours, and on average about 3 times a week. So that person is having to transport themselves to the dialysis unit, for those hours. Again, 3 to 4 hours, about 3 times a week. But we have the independent, therapy modality as well, where a person is able to dialyze themselves at home in the comfort of their home, by themselves or with minimal support. And that we also provide here at Niagara Health.
Felicia, thanks for shedding some light on some of these services. We appreciate your time today.